Hello, I'm Matthew Bryant and I'm Chief Executive of Dorset HealthCare and Dorset County NHS Trusts. Last week in Dorset HealthCare, we had our annual general meeting. And I know many people couldn't attend who would have liked to have been there. So I want to tell you the story of the AGM in just a couple of minutes. So we had our AGM in Wareham Town Hall. It's really important that when we have it, we're present amongst the communities that we serve. And about 50 people were there on the evening. We started off with some very moving patient stories that came from clients who had received care and support from our homelessness service. And they spoke about the difference made for them in incredibly difficult times. And I thought that was an amazing tribute, not only to their courage and the way that they told their own stories, but to all the work that Graham Dennison and team members do with those members of our community. We then went on to a presentation from our stroke and neuro rehabilitation team that is based in the community. And this presentation was led by Louise Clark, who's a consultant therapist, Louise Clark, who is a consultant therapist, and Louisa Hardy, who is the service manager. And they told the story of the service and how it's been developed in the community, how it also provides bed-based rehabilitation based at the Yetman Hospital in Sherborne, and the changes that they and other colleagues have made to the service, which have allowed it to expand its scope and remit. And again, there were amazing stories told on behalf of patients about rehabilitation and the great successes that have come out of the service. And one of the key things is the continuity of care that we're able to provide to people, working with people over a much longer period than the traditional early supported discharge service. So an amazing thank you to those team members for all the work that they do. We then went on to the formal part of the annual general meeting, and David Clayton-Smith, our trust chair, and I spoke, reflecting really on the many challenges that we've faced over the past year, but also our successes, the challenges that remain, and then the way forward that we see for services in the future. So we talked about the contribution of staff and how much of a difference people have made over the past year. We spoke about the changes that are happening nationally with the new government, the Darcy report for the NHS, and look forward to the 10-year plan for health in England, which is due to be published in the spring. We spoke about the work that we've done with many colleagues across the organisation to develop the joint strategy for both trusts, with its aim of achieving healthier lives, empowered citizens, and thriving communities. And then we also spoke about our important partnerships that we have with many people, such as the GP Alliance, with whom we're working to develop integrated neighbourhood teams based locally across Dorset, and also our important partnerships with the voluntary and third sector, who've helped us so much in the redesign of mental health services. We spoke too about our ongoing work to address inequalities and to make sure that we've got an inclusive culture within Dorset Healthcare that values all voices. And we reflected on the work done to develop the new hospitals programme buildings at the St Anne's and Allenhurst Road site, the opening of the Access Wellbeing Hubs in Poole and Weymouth and Boscombe, and some of the great service changes that are coming out of the Working Together programme between ourselves and Dorset County Hospital. After we spoke, we had a section where some of the trust governors spoke about the work that they do to support us, to represent the views of their communities, and to make sure that we're working effectively as a trust board. And then Chris Hearn, our Chief Finance Officer, presented the annual accounts, which gives a record of all the money that we spend on behalf of the NHS and the public to support what we do. We then made the meeting interactive by using a Slido poll, which is a way that you can get comment from everybody in the room in real time, to ask questions about the top priorities that were in people's heads for future focus. And things that came out of that, the top three things were a focus on our urgent care services, our mental health services for children and young people, and other services for children and young people and families. And that's not to overshadow or neglect any of the other services that we offer, but those were the things that people in the room present at our AGM wanted to hear more about in the future work of governors and at future annual meetings, and we will follow through on that. Finally, there was an opportunity for people in the room to ask me and other members of the executive team present any questions that they wished. So a number of questions were asked, and they included questions about the future of community clinics offered by community hospitals across Dorset, how we support care, including emergency care in rural areas across our very big catchment area, and also how we go further in celebrating improvement and the great innovation that is led by our staff every day as people make services better within Dorset Healthcare. So we also reflected about the challenges that remain and the way that they show up for our population and for our colleagues as they come into work every day. So that's an account of our annual general meeting. If you weren't there and you'd like to make a comment on what you've just heard, or a suggestion, or you want to take the opportunity to ask a question, do email me or get in touch in some other way. And my email address is matthew.bryant2@nhs.net. Thank you for listening to this.